we're going to talk about how to walk if you have lumbar stenosis. So a lot of times what happens is as we start walking, if you have stenosis, you're going to notice that as you start walking longer, you're going to start having problems. And the problems that you'll typically have will be pain in your back. You could have numbness into the leg. You could have pain into the leg. You could also have weakness in the leg. And this is typical for how stenosis will present. Now, we have other videos where we talk about stenosis and what it is and all those things, so make sure you look at a description for more of those. But today we're going to talk about specifically exercises that can help us walk longer if we have stenosis. Now, make sure you bookmark this so that you can resource back to what these exercises are so that you can continue to improve your symptoms over time. Now, a lot of times what happens is we get this diagnosis of stenosis and it comes from our doctors. They do an MRI, they'll do an x-ray, and I can tell you most of the people that come into our office, their diagnosis of stenosis isn't really true. Like maybe they have some, yes, we all have some as we get older. It's kind of like we all get wrinkles on our face as we get older. But when we really truly test our clients if stenosis is really causing a lot of their pain, 9 times out of 10, it's not the case. Or if they do have some stenosis, we're able to improve their mobility enough that their walking gets so much better. And that's what we're going to talk about a little bit today. So what typically happens when we see people coming in with stenosis, they look like this. They're walking and their body is farther forward like this, and they're not able to really straighten up. And that's a problem. And a lot of times it's just because they've had back pain for so long that they keep on accommodating it and going farther forward because honestly, most people with back pain, they just want to stretch the muscles in the back when the muscles really are just the symptoms. And when that happens, the joints get stiffer and stiffer and stiffer. Here's the problem with walking is when we walk, our hips move. They're little mini extensions. So the more motion that we can improve to help us stand up straighter, the better our walking is, the longer we're going to be able to walk. We've seen it time and time and time again in our office. So we're going to talk to you about how we can do some stretches for our back, not stretches that you think that we're going to be doing, really joint stretches to start helping us improve our mobility. Now, we could have some stenosis symptoms, and we'll talk you through what that looks like as we get higher and higher into stretching the joints. But the more we can stretch, the more we can keep that mobility, the better we're going to feel later on in life, the better we're going to feel with walking. So we're going to talk about that. That's the first step, is how can we improve the mobility? The next step is we're going to be prepping the muscles, and we'll talk about a couple of exercises that will help us prep those muscles for the walking. But let's go into the mobility stretch first. So if you have any symptoms in your leg right now, you just want to monitor those. So you just take a mental picture of like, where do you feel it in your leg? We're going to see if we can pull it out of your leg with this exercise. Now, because we're kind of stuck forward a little bit like this, maybe you are standing a little bit straighter. We'll kind of go into ways that you can progress this. But if you're kind of stuck forward like this, and this is kind of what you feel like, and you don't feel like you can actually straighten up, we're going to use a pillow. So if you notice any symptoms in the leg, even just right now, then just kind of monitor what that feels like right now. And we're going to use a pillow, and we're going to just kind of accommodate you being able to bend forward so we can start out there. So what I mean by accommodate, we're going to use a pillow and put it through our hips like this. You might need 2 pillows. It just depends. And here's how we're going to know if we're going to need 1 pillow, 2 pillows, or no pillows. Remember how I told you to kind of monitor where your symptoms are? If you notice symptoms in your leg, in your hip, in your back, when you lie on a pillow and hang out there, you're going to want to notice, what are my symptoms like? Do I have symptoms? Are my symptoms getting better in the leg? Are my symptoms starting to ease in my back? Are my symptoms easing in my hip? Are the symptoms getting worse? We need to know what's happening there with that leg. So if they're getting better and better and better, you're just going to hang out on the pillow and hang out here for a good couple of minutes to get things to kind of ease. If you notice that your symptoms are getting a little bit worse, then you need to put a second pillow underneath your stomach to kind of accommodate that. You just might have so much
tightness where your joints don't move into any kind of extension whatsoever. And we're trying to really start stretching those joints out a little bit. So you'll hang out here for a little bit. Everything will start easing. You'll notice that, gosh, I might actually, when you get off this, you might actually notice that you're able to stand up a little bit straighter, even by just using the pillow. So this is the first exercise that we want you to do. Now, how you can progress this is when you get on the pillow and you hang out here for a while, and you're noticing that, wow, I don't have any symptoms anymore. It feels actually pretty good because I've been hanging out here for a little bit. Then your progression, and this may take a day, it could take a week. It doesn't, you're just gonna have to listen to your body and understand kind of where your symptoms are. So if it's, you're to the point where like, wow, I can hang out here now, I have no symptoms. It feels actually pretty good. You can then take the pillow out and start working on just lying flat. Same kind of rules go. If you notice that your symptoms are starting to get a little bit worse, you're starting to notice it's kind of picking up a little bit, then you go back to the pillow. And sometimes people have to start with a pillow initially, and then they can take it out within like 30 seconds and then go flat on their stomach. If you notice that this is getting pretty easy, the next progression will be to kind of just come up onto your elbows to get a little bit of extension. If this is too much, you can start out where your elbows are more in front like this, where you can just kind of hang out in this position, not as much extension. You're monitoring your symptoms the whole entire time to see, because the more we can get a little bit of extension in our back, the better we're going to be able to walk. Because again, as I was describing, when we walk, our pelvis moves and we need a little bit of extension in order for that to happen. And when we don't have it, that's what produces pain in our legs. Now, if these exercises, you do them with a pillow and you're like, this doesn't help, then you need to stop. Make sure you get to a healthcare provider that can really evaluate you and kind of figure out what you need to do. This works for a lot of people, but there are times when if you're noticing that, this is not working, my symptoms, I feel like they're getting a little bit worse, this is when you need to go and talk to a healthcare provider to really hone in on what's going to be specific to you. But this works for a lot of people. And the more we can get us standing straight up like this, the better and the easier it is to walk. So that's the first exercise that you want to do, because the more we can improve that mobility, the better able that we're going to be able to walk and walk a little bit farther. So the next is we want to prep the muscles. So this is the next phase, is prepping the muscles. So we want to get the abs to kind of work, but we're going to do it through breath work, and we're going to do it with our ribs, because it's going to actually get us to contract our muscles and make them work. So you'll do this in a sitting position. You want to put your hands on your ribs, and then what you're going to do is you're going to take a deep breath in. Your ribs are going to expand, and then you're going to blow all your air out, and you're going to try to pull those ribs in. When you do that, you're going to use your ab muscles, and you may even go into a little bit of flexion. So or a forward bending. So you'll exhale. When I do that, you can see everything's going to have to work in through here. We're getting the abs to kind of fire. We're getting everything to kind of stack on top of each other with the ribs and the pelvis and all this stuff. Helps a lot. Gets those abs prepared. Again, inhale and exhale. Use those. Hold it for a little bit. Same thing. Inhale and exhale. And each time, you're trying to pull those ribs farther and farther and farther in. You're going to do this about 7, 8 to 10 times so that you can really get those abs to activate. You're really using your breath to get those ribs to kind of pull in so that we can get those abs to activate a little bit better. Doing this a little bit before you start to walk is also going to help you engage those abs to help you walk a little bit farther. The last one that we're going to do is we want to prep the glutes. We need the glutes to fire. All of this, the abs working in and the glutes kind of firing, are helping us kind of maintain a good posture and position and getting those muscles to kind of activate. So what you're going to do here is we want to activate the glutes, and you're just going to basically squeeze the glutes, hold them just a little bit, and then relax. So we're not arching too much to kind of squeeze those glutes. You're really, again, kind of tucking a little bit to get those glutes to kind of fire. Again, hold them about 3 to 5 seconds and then relax.
These again, you want to do 15, 20 times, getting the abs to work, getting the glutes to work, are muscles that we want to start activating a little bit more to help us walk a little bit farther. So give these 3 exercises, the mobility exercise and the strengthening exercises, give these a chance, get them to work, and see if this is something that will help you walk a little bit farther as if you have that diagnosis of stenosis. These are things that work all the time in our office. They're common things. If you notice it's not working for you, then definitely get with a healthcare provider that's going to be able to understand the body to put the pieces of the puzzle together. You might need some manual work and some other exercises before these to really help you feel your best. Again, my name is Stephanie. We help clients all the time avoid surgery, injections, and medications while getting their life back. We help put the pieces of the puzzle together. So make sure that you subscribe to our channel because we're putting content out all the time to help you understand your body better, to help you navigate the healthcare system better, to get you feeling good.